Dr. T. Hunter Newsom is the founder and medical director of NewsomEye, specializing in cataract and LASIK surgery and glaucoma. We are happy to welcome him back, along with a cataract patient from Sebring, Phyllis Risher, who has Newsom eyes. Good morning.
Good
morning. To see you again, doctor.
Good. Thanks for having us back.
We love when you bring patients in and kind of hearing their stories, because I think people can relate to that, because certainly with eye care it can be a little overwhelming, maybe a little intimidating. But let's start, kind of explain what that Newsom eye is and kind of what you are doing at your practice. Really.
Well, we do a lot of investigation of new lenses, and one of the lenses, she has an HD lens, which is from a company locally here, Lens Tech, out of St. Petersburg.
Oh, cool.
We're the principal investigator, which is great for us to really develop new technology with them. I put the same lens in my father's eyes, so I saw her back a week or two ago. She was at her one-year visit and just described how well she was doing, and really said, you know, put into words what it means when I hear patients say, I have Newsom eyes and I love it. So we brought her on to kind of give you her experience and let you ask her some questions and see what it was like.
Well, and I want to hear about the experience, because we talk about this a lot, of what it means to have Newsom eyes, and that's from the whole, you know, starting from the beginning, kind of the process. Tell us a little bit about your story and when you knew to call.
Well, I had cataracts, and I had been told they weren't ripe, and by the doctors in Michigan. And when I saw Dr. Newsom, he said, "We can make you see." And I went, "No way." So I scheduled my surgery. It was a great experience. It was pain-free. It was very quick. And I saw right after the surgery.
Really?
Yes. The most immediate thing I noticed was when I was wheeled into recovery, I could see the clock across the room. I could see the faces of the nurses and staff that were caring for me. And I was told to go home and, you know, kind of take it easy, because I just had surgery. So we turned on the television. And my husband's always chiding me, because we have regular television channels and HD channels. And he would say, "Why are you watching that in regular TV? We have HD." And I'd put it on the HD and I'd say, "What's the difference?" So I'm sitting here with my new eye, which is less than 2 hours old, and I'm watching the television, and he said, "You know, that's available in HD." And I went, "Okay." So I put on HD and I looked, and then I looked again, and I went, "Whoa, no wonder people want to see in HD. I'm like, I could see the colors, the sharpness, the clarity. I'm like blown away.
Wow.
I'm a person who's worn glasses since I was 5 years old. And so I've never seen the world without something on my face. And I cannot describe to you being able to ride my bicycle, which I love to do. I have a recumbent bike, and I'm riding the bicycle. This is a week later, and I'm riding my bicycle along. And I hear this lovely songbird singing up in the tree. And I look up, and I'm about 80 feet up, and there's this beautiful bird singing his song. I got goosebumps. I could see the bird. I could see the bird. And for me, the experience was life-changing, because I'm a person who's never seen without something on my face. To wake up in the morning and see my husband of 48 years and actually see his loving face, to wake in the night and look across the room and see what time it is. You just cannot imagine.
I can imagine, and I love this. We're out of time now, but I love your story. But what's cool, you even mentioned she's from Michigan. You have patients traveling all over the country to come to you and your team.
We do. I remember one patient that came in from South Tampa and was upset to travel to Carrollwood, and she was complaining about an 8-mile drive coming north of Kennedy.
I don't know how lucky we have.
Yeah, exactly. So meanwhile, sitting next to her was this patient from France, didn't speak a lick of English, who was having LASIK. On the other side of her was a patient that flew in from Arizona to have surgery, and she realized, well, maybe it's not so bad driving 8 miles to see Dr. Newsom.
Well, thank you so much for bringing. You are such a joy.
Thank you
for coming in.
Thank you.
If you want to have Newsom eyes, like, man, I think everybody does. Thank you so much. And there is the number to call, and their locations there as well. And we look forward to seeing you back, doctor. Thank you so much.
Thank you.